Hey, this is Sandy.
And Randy.
And we're here on AT Corner.
Being an athletic trainer comes with ups and downs, and we're here to showcase it all.
Join us as we share our world in sports medicine.
Welcome back to the corner, where the cool kids hang out. AT Corner.
Trying something new?
Trying something a little bit different.
I really thought you were going to go back to the James Bond opening.
No, I'm keeping it fresh.
All right, cool kid.
That's right, we're the cool kids here.
What are we talking about today?
Today we are talking about hamstring strains. So I think what better way to start off with a story.
Go ahead.
So this is actually a very ironic story that just kind of appeared. So I was we were hosting a track meet, and an athlete goes down with a hamstring injury. And this athlete was not affiliated with any school. He was running unattached. He was running on his own, right? So we took a look at him. We deemed it was a pretty significant hamstring strain, gave him recommendations because, he wasn't with the school. So just trying to help him out the best we could. So the next year rolls around. Obviously, with the university, right, you bring in some incoming athletes. And I recognize this kid from when he got hurt. So I'm like, oh, hey, cool, he's on our team now. I worked with him a little bit in the off season to get him back, right? Well, I had these spikes from that day that just sat under my desk for the entire year because I thought it was one of our athletes, but I didn't want to throw away spikes. So I just left them there until someone said something.
Yeah, spikes can get expensive.
Yeah, exactly. So they were sitting under my desk for a year. And I don't know what got us started talking about that day, but...
With the kid?
Yeah. So the athlete I was talking about, right? He was talking about like, yeah, man, I lost my spikes that day, And I said, really? What'd they look like? And he said, oh, they were this, they had this feature. And I'm like, hold on. And I run to my office, I grab the spike bag, and I show him, I'm like, are these them? He's like, yes! It was the craziest thing. He got basically new spikes because he was even saying the day that he lost them, they were still pretty new. So he basically got brand new spikes.
I don't know if you want those jinxed spikes, though.
That's very true, but I couldn't believe that those were his spikes, and he just so happened to get recruited onto our team.
I know, that is pretty crazy.
Oh my goodness. So, anywho, the objectives of what we're going to cover today are we're going to review some of the anatomy of the posterior thigh and pelvis and how it functions while you're sprinting. We're going to understand the common risk factors associated with hamstring strain injury, identify effective prevention interventions, understand the consequences of a hamstring strain injury, and then review the management and return to play considerations.
And of course, we're going to make these applicable and actionable to bring to your practice.
Absolutely. So I know for me, hamstring, especially in the world of track and field, hamstring strain injuries are a big deal because the track season or cross country season are very short. So missing almost a month can almost mean the end of the season for you. So if you look at where the hamstrings originate, right, they come off the posterior pelvis, off the ischial tuberosity. Well, they'll also continue to blend in with the sacrotuberous ligament and then go into the thoracolumbar fascia and then the lats, right? So it just shows how connected things are, right? The trunk, the upper extremity are connected to the lower extremity. Now, as we're talking about the posterior thigh, you cannot forget about the adductor magnus because it has the same attachments as, or at least some of the adductor magnus has some of the same attachments as the hamstrings. Part of that muscle originates from the ischial tuberosity and will blend with the hamstring muscles. And also, one of the actions of the adductor magnus is hip extension. So I've seen it before where you're treating a hamstring issue and you're treating it perfectly and they're not really getting better. Keep in mind, adductor magnus could play a role, and some people kind of forget about that.
And I know you keep bringing it back to track and field and cross country because obviously that's what you know and your expertise is in. But in all settings, we're dealing with gait and movements of hip extension.
Yeah, absolutely. I mean, this is not an issue that's just unique to track and field. Football has this. American football has this problem. Soccer has this problem. Like it is a big deal, and there's a lot of re-injury rate. There's a high re-injury rate that comes from this, and that's why I really wanted to do a topic on this to discuss what's worked for me and where the research is heading.
Especially because it's so broad.
Absolutely. So we talked about the anatomy, right? So here's the role the hamstrings are taking when they're when they're sprinting. So, right.
Making up new things over there.
I'm making up some new words here. So we all know the phases of gait, right? You have your swing phase, your stance phase, right? So an area that we're really going to look at is the swing phase, because that's where predominantly you're going to see the injury event happen to the hamstrings. So as you're going through the swing phase, that limb is going into hip flexion and knee extension. Well, when you think about what the hamstrings do, the hamstrings are hip extenders and knee flexors. Mm-hmm. So they're going to eccentrically control the motions of hip flexion, knee extension to make it a smooth motion. Well, that eccentric contraction, that's a very high load and a lot of force is being produced. So keep that in mind as we're talking more about how to manage this injury and how this injury happens. Also, don't forget, the glutes are also a part of this equation. So as you're going into hip flexion, the glutes eccentrically control that motion. So you can see that there is a symbiotic relationship between the glutes and hamstrings. If you break it down based on the individual hamstring muscles, right? So we talked about that knee extension moment happening in the swing phase. The semitendinosus muscle has been shown to have larger activations throughout that swing phase and will actually peak at terminal knee extension. So what that means is the highest activation is right when the knee is basically fully extended. Well, the biceps femoris will peak before that, so it peaks mid to late swing phase. So the semitendinosus is active throughout the entire range basically, and the biceps femoris will peak and then kind of slow off as the knee gets fully extended. And that'll be important as we talk about how to rehab this, how does this keep happening, because the biceps femoris has been shown to be the muscle that tends to get injured of the hamstrings compared to semitendinosus, semimembranosus.
So really fast, because I feel like you just said a ton of words. Can we just recap that in like one sentence?
Yeah, so essentially the hamstrings help control knee extension and hip flexion.
So they're mostly working eccentrically.
Exactly.
Okay. So why don't we start talking about risk factors?
So a lot of risk factors have been looked at in the literature, and one of the more prevalent ones is strength, because it's pretty easy to measure, and a lot of people are thinking that, hamstring strength could be an issue. Mm-hmm. Well, when you really dive into it prospectively, the evidence is very limited. You know, the prospective studies that have looked at it have found a very weak association, and these studies have been really huge, using a lot of participants in elite soccer over a year or 2 years. So these are very well done studies, and they're even showing that it's a very weak association, and I have my ideas about it, which we'll kind of talk about a little bit later. So as far as hamstring strength, and that goes counting concentric, eccentric, doing ratios between quad strength, hamstring strength, all across the board, it's not a good indicator. Now, there's some people who like to think about glute strength, and we've all talked about how glute strength is important in rehab. And there's really not a ton of prospective studies that have looked at it, but there's one that went into collegiate sprinters, and they found that lower glute strength was a risk factor for developing a hamstring strain injury. And then in a retrospective study that looked at some kinematics, they found that increased glute med activity was predictive of getting a hamstring strain injury. So that just shows if your glute med's firing too much, that means it needs more activation because it's weak.
Got it.
So keep that in mind, that glute strength could play a role. There just hasn't been a ton of research in that.
Now, before we lose you guys, if you guys haven't listened before, something that we do like to highlight is that with these risk factors, a lot of times we're not saying like, oh, you need to be doing these things with every single one of your patients to prevent every single one of these hamstring injuries. Instead, we're encouraging you to, when you have a hamstring patient, look at these for maybe a source of something that might predict re-injury.
Yes, exactly. So another area that I'm very big in, and I think will contribute to the whole strength idea, is now looking at the kinematics. And there hasn't been any prospective studies that I found that looked at any kinematic deviations and the risk of sustaining a hamstring strain injury. But the ones that have looked at it retrospectively have found that increased anterior pelvic tilt and greater lateral trunk excursion were displayed in those with a previous hamstring strain injury. So what that means is your core is not functioning properly to stabilize your trunk and your pelvis, and it's putting more strain on the hamstring. So when you think about it, right, an anterior tilt, well, we know the hamstrings are posterior tilters. So if you are an anterior tilt, you're already creating more length. So now the hamstrings are on more of a stretch than what they already have to deal with. And we talked about how the hamstring is connected to the trunk. Well, if you're tilting a different way too much, more tension. So you could see how that could be the reason there.
Well, not to even mention what you were talking about before with the whole posterior chain.
Exactly. It just shows that connection. And it also gives support to the studies that have looked at using a proximal exercise program, so like core and glute strengthening, to protect against hamstring strain injury. And there was a good prospective study that did a core prevention program, and they actually had lower hamstring injuries. So that just shows the core does play a role. And if your core doesn't fire correctly, that means your kinematics are off. So this might not be a strength thing when you test like core strength, but it could be a motor thing.
Honestly, if you're putting a injury prevention program together and you're not including core, I don't really know where you're heading.
You should definitely include core for sure. But it just goes to show you that we might need to be thinking more about motor function and not strength, because strength, how it's measured, is it's one moment in time, whereas motor control, you're testing their function and their movement patterns.
Because what are they going to be doing during sport?
Exactly. And that goes into an area that I also think is why the strength testing finds some evidence that it is a risk factor, but not a strong proof, and that goes to endurance. So a prospective study that looked at the single leg bridge test, so essentially you put the athlete in a single leg bridge, their knees about...
Like a glute bridge?
Yeah, except for this glute bridge, their knee was put in like 90 degrees of flexion, so their leg's pretty straight. And they just had them do a single leg bridge until failure. And those that, I think it was scored less than 20, went on to had a higher risk of...
Less than 20 reps?
Yeah, less than 20 reps, thank you. Went on to later injure their hamstring. They had a higher risk of doing that. So if you fatigue earlier, or you don't have enough endurance, you have a higher risk of injury. And they actually did a study that showed that those that went on to do endurance strength training had a lesser decline in strength. Well, we know with hamstring injuries that when do they tend to happen? Towards the end of the game or towards later in the year. Well, you're fatigued. You've accumulated so much load. You're starting to fatigue at that point. So I think that's why these strength studies don't have great findings, because they don't take into account fatigue. So if you fatigue more, that means your strength goes down. So then in that case, strength is a predictor, but it's not the strength that's the problem. It's the endurance factor. Does that make sense?
Yeah. Well,
sometimes I ramble, so Sandra has to keep me grounded to make sure that made sense.
I mean, we are in a podcast. I get lost in podcast world. Okay, so we just spent the last 15 minutes basically talking about the anatomy and kind of risk factors that we don't want to focus on too much before injury.
Absolutely.
But how are we actually addressing these?
Yeah, so before I move on to the prevention strategies, I did forget to mention previous hamstring strain injury is a big predictor of future hamstring injury, and we'll talk about that and why our rehab needs to change. So we'll talk about that after I talk about prevention stuff.
A little sneak peek.
Ooh. So anytime you think about prevention strategies for hamstring strain injuries, the first thing you're going to find when you look it up is eccentric training, and in particular, the Nordic hamstring curl. So eccentric strengthening programs have shown great benefits, and I mean, there are numbers that have been from 50 to 70% reduction in hamstring strain injuries. So eccentric strengthening is a great thing to include. Now, I know everyone's probably thinking well, if strength hasn't been found to be a great risk factor, then why are the eccentric programs beneficial. And there's a lot of reasons why. One, if you have a higher strength threshold, that means when you're fatigued and it drops, maybe you have more strength than someone who had less and fatigued, right? And also another thing is, and I've mentioned it before when we talked about Achilles, is eccentric training has a huge neurological component to it, and it can really change how the motor system functions. So again, going back into how we move and movement patterns, this can have a key role into that. So don't just think like, oh, I'm just strengthening. No, eccentric training does a lot than just strengthening the muscle. And this also leads into, if you're putting together a prevention program, maybe you should include strength endurance, right? If you can maintain your strength for longer, that can be beneficial. And there's studies that have shown that. Most people are trying to figure out, okay, well, how do I program that? And there's studies that looked at including your hamstring program after practice because they're already in a fatigued state. But those studies showed that they increased their endurance, but they didn't increase their strength. Well, the whole point of doing these programs are also to increase strength. So I would say program it like you would like a strength and conditioning program. Have a certain phase in the season where, okay, we're going to focus on strength. And then in a new block, then we're going to focus on endurance. So then you worked on their strength. Now you're going to work on the endurance portion. So it goes back to periodization and like making sure you know how to program.
Well, and when you're working on the endurance after you've already had that strength, now you're just working on maintaining that strength.
Exactly.
And working in a fatigued state.
Exactly. And of course, as we just mentioned, you should definitely include proximal neuromuscular training. So training the core and of course glutes. I feel like I haven't stressed glutes in this episode as I should, but remember the glutes work hand in hand with the hamstrings. So if your glutes aren't functioning properly during that swing phase, and they're not eccentrically controlling hip flexion as well, the next muscle that's going to have to do that job is the hamstrings. Well, the hamstrings already have a big job when they're controlling knee flexion or knee extension and hip flexion, right? They already have a lot going on. So if your glute's not functioning properly, hamstrings are going to have to take over. So you should definitely include glutes because they're a major contributor to this phase of gait. And then the last thing I would say is also monitor the training load. And it goes back to controlling fatigue. If you have a huge, like if you're having a training period where they're doing a lot of work, they're going to fatigue a lot more. So don't just go out there and crush these kids. I think we need to do a better job of knowing like, hey, you know what, my hamstring's tight today. Okay, well maybe we need to back off the training a little bit for you to help recover and help the muscle adapt to the training load instead of just constantly crushing these kids.
So how would you, we were just talking about how we should maybe be doing these prevention programs at the end of practice. How do you prevent a hamstring injury happening then?
Like during the actual program?
Yeah.
Well, hopefully you're not going out there crushing the kids, and you yourself should know, like, okay, they had a hard day today. Maybe I shouldn't do this training program today. Or when you're scheduling it out, know what days tend to be their hard days. I mean, luckily, again, coming from a track world, it's a little bit different, but they tend to be consistent on what days are the hard days and what days are the recovery days. So it makes it easier on you when you're trying to schedule out, like, okay, today we're going to do this. But that could be in a conversation with the coach, because I'm sure you want to obviously let the coach know about this aspect. So that would be a great conversation to be like, hey, what days are you expecting to be hard days? When can I kind of program this?
Well, you could also have a set thing that you do and, play it by ear for that week. Like, we just had a hard day. You know what? Let's not do this today, but we'll do it tomorrow.
Exactly. And it goes back to you're the clinician. You get to make this decision. It's not, we're not doing like, oh, here, just go do it. No, this gives you a chance to make that decision.
One size fits all is not athletic training.
That is very true. And that's what we're seeing more with a lot of these topics at conventions and stuff. We're really trying to focus more on individual than just injuries, I would say.
But before we do move on, I do want to ask, like, how long are you thinking that this program is going to be? Like, is it more like a 5-minute, like few things, 10-minute, or like more like 45-minute?
I think you need to gauge it on what you think your athletes are going to do, because compliance, especially when you're talking about hamstring prevention, is a key thing. They were like, take the Nordic hamstring curl, right? It's a hard exercise. It's difficult to do. It can be uncomfortable. Well, if you pick that exercise and the athlete hates it and doesn't do it, well, then that prevention program is not good, because even studies have shown those that are compliant do have great results, and those that are not compliant have poorer results compared to the group that was compliant. Mm-hmm. So compliance is key here. So don't think like, oh, I have to do the Nordic hamstring curl. No, you can do deadlifts. That's an eccentric hamstring exercise. You could do a split squat. That includes eccentric hamstring. So keep that in mind when you're programming.
Or like hamstring tantrums, or like the slide board.
Exactly.
Or like a glute bridge on the slide board.
Exactly. So I would say you really have to gauge on what you think your athletes are going to be able to get done. So I would say if you do maybe 1 or 2 exercises for the hamstring, an exercise or 2 for the core and glutes, I think you can bang that out in like 15 minutes, you know. So I think you can make it as elaborate as you want, but judge your athletes, because they're the ones who have to do it, and they should have fun and enjoy it at least.
I've put together a lot of circuit programs, and I would say probably even less than 15 minutes from what just the few exercises that you were saying.
Yeah, it all depends on how many you're having them do and how quickly you're moving through stations. I mean, you could definitely make it a quick program and still be effective.
Okay, so we spent this whole time talking about what happens before injury and prevention programs and all that stuff, but obviously we're not going to prevent everything. Injury happens. Can we break down what actually happens to the hamstrings when they do get injured?
Yeah, so when you get an injury, you have the healing phases, right? So you go inflammation, proliferation, maturation. Well, a key component of the early stages of the healing process is pain. Well, as we know, or at least what some of the literature has talked about, is pain changes the motor function. And there was a great article that looked at explaining how pain does this, and they called it the new pain theory. So what the article was talking about with the new pain theory was pain creates a change in the motor system. So it's a change in the mechanical behavior of the muscle, muscular coordination within the muscle and between other muscles, and a change in the actual motor cortex. So the actual whole motor system is changing based on you moving in pain. And this is all to protect the injury. So it has that short-term benefit. But the long-term is, if you keep moving like this, it now becomes your new motor program, and that is inefficient, and you're going to lead to either a re-injury or another injury. And this is why I think we're seeing a high re-injury rate, because we're not addressing the motor system in our rehab. I think the older view of the rehab is, we're strengthening. No, we need to actually attack the motor system to create a new movement pattern. Mm-hmm. And this has been supported in the literature. After a hamstring strain injury, the hamstrings have shown decreased muscle activity, which has led to decreased strength and a decreased rate of torque development. So they have to generate a lot of torque really quick while you're sprinting. And if you don't have that capability, you're in a vulnerable position. As far as support for muscular coordination, so we talked about how each hamstring muscle has a different activity level during sprinting. Well, in those that have had a hamstring injury, the semitendinosus and biceps femoris actually had similar muscular activity levels. Well, that's a problem when normally semitendinosus should be more active and longer. So you can just see after hamstring injury, more load is shifted to the biceps femoris and not the semitendinosus. And some of it they also contributed was the semitendinosus fatigued faster, and that's what brought the activity level down. But you can see there's a change between these muscles that we need to address, that we may not be doing that in our rehab.
Okay, so how should we rehab these?
Again, I think eccentric exercise needs to be the emphasis of your rehab. And that's not saying concentric work is bad, because early on, they may not be able to tolerate eccentric contractions, right? That's a high level contraction. It's lengthening, which is, if you're already in a strain injury, it's going to hurt, right? So I'm not saying, hey, day one, let's bust out some deadlifts. No, that doesn't make sense. So don't let people tell you like, oh, concentric's bad, you should never do it. No, maybe day one, day two, they should be doing that because it's something for them to do.
Never is not a word we use in athletic training.
Exactly. Now, I'm the Star Wars nerd of the show, so only the Sith deal in absolutes.
Yep.
There we go. But anywho, so don't think concentric's bad. I would just say you want to shift to your eccentric strengthening as soon as possible, because that's where you're really going to be getting the benefits. You're going to retrain the motor system to go back to a motor pattern that is more efficient, and you're training the hamstrings like sport specific, right? They have a huge eccentric load while you're running. That's how we should be training them. So eccentric is definitely what you're going to want to focus on. And you can even break down your exercises from knee dominant eccentric exercise and hip dominant. So when you think, if you're confused on what that means, the Nordic hamstring exercise is a knee dominant eccentric exercise because the motion is coming from the knees. Whereas the deadlift is a hip dominant eccentric contraction because the movement's coming from the hip. So just keep that in mind when you're designing these programs. You can even split the eccentric exercise program a little more fine-tuned.
Well, or this is something I just thought of too. If someone's having pain with knee dominant movements, but they're not having problems with hip dominant movements, then why don't you start there?
Exactly. And that goes into also focus your rehab on the core musculature. Right, so maybe they're too tender to do stuff from their hamstring. Well, day one, you can pretty much start them on core and glute. And we've already talked about how that's important in the rehab and prevention of hamstring strain injuries, right? If you can control the pelvis, you can put the length of the hamstrings in a more optimal position to create optimal torque.
And I think I've said this before, but TA. I think I do TA with like 90% of my patients.
Absolutely. It's a very important core muscle. It connects to the thoracolumbar fascia, which connects to the hamstring. So
the hip bone's connected to the
thigh bone. Exactly. So if you're able to train core and glutes, you're able to control the movement of the pelvis better. You're able to optimize the activations of those muscles to take load off the hamstring. And then that is also going to make the hamstring function more efficiently, which means it's not going to fatigue earlier, and it's not going to put a lot of strain on it. So again, you can see how this all makes sense.
The core is called the core for a reason.
Exactly.
Okay, so when is it appropriate to return to play? And twofold question. When would you take someone out for a hamstring? Because, I mean, I think a lot of times when we're students especially, we think of black and white, someone's hurt, they can't play, but especially with my clinical philosophy, I try to let people play for as long as they can and minimally take them out, especially if their season's short.
So I'll start with the return to play, and then I'll talk about the when to kind of take people out.
Okay.
So for the return to play, and it goes back to when we talked about Achilles, you need to have some kind of criteria. And I think that's one of the reasons why we're seeing a high re-injury rate is a lot of people don't have a set criteria. They're just kind of going off of, okay, you feel like this. Okay, we'll do this and this. And that should be a part of your criteria, but let's be a little more in depth to protect these athletes and have a better idea of what they can do at practice and what they can't do. So I would say definitely pain on palpation. Like if you touch the muscle, is there pain? Test their hamstring strength, test their glute strength. If all those are still pretty low, then maybe they can't do a ton in practice today. Maybe they can only do light stuff. There's this one test that's really been coming out, and NATA, I believe it was last year, had a good presentation on it. It's called the Askling test. And basically what it is you have the athlete lay supine, and then the leg that's injured, you keep their leg straight. And by the book, it's supposed to be in a knee brace to prevent knee flexion, but I can see that can be tough to do, and maybe you don't have a straight leg knee brace. So what they'll do is they'll keep their leg straight, and then they basically try and kick it up like a straight leg raise as fast as they can. And if there's any pain or apprehension, that would be positive. So you don't want that. So if they do that test and they don't have pain or apprehension, they can move on. So that means they passed that test.
That's lying down?
Yes, laying on your back. So that could be a great test because it's something functional, because you're testing them in a quick lengthening motion and you're gauging how they feel. Well, if you have an athlete that, oh, you know what? I don't trust my hamstring. Well, maybe they can't progress very much. Maybe we need to do a week or two of strengthening. And that's the original article that talked about this. That's kind of what they did was those that had apprehension or pain, they did another week or two of rehab, and then they tested them again and they felt more confident in their hamstring. They didn't have pain. So this test can help kind of guide where they're at. Can they move on to a new phase, or should we kind of keep them at this phase for a little bit and then test again? I would say something that gets overlooked is dural tension, so your slump test. Well, the slump test, right, we think of as more of a low back sciatic nerve test. Well, the sciatic nerve runs with the hamstrings, right? Well, if you have scarring in the hamstring from injury, it could scar around that nerve. Well, when you move, those nerves should glide smoothly. So if you have pain or tension with the slump test, that could lead to pain later when they're getting back to play. So I would definitely say attack that and see if you can get improvements there.
And how many times have we talked about the posterior chain?
A ton.
Yeah.
Also, I would say let's start looking more into performance tests. I know I've said it before, but the single leg hop, the triple leg hop, right? Those are very functional, explosive activities where if they're not equal to a baseline test or equal with their good leg within 10%, maybe they're not ready for more functional stuff. Maybe they need a little more strengthening, and then you can progress them to a new step. And that also goes into the last thing is always remember to monitor training loads, especially when they're returning to play. Make sure they're not going into something too fast or too quick, right? You don't want to build up excessive load. Obviously, sometimes it gets a little different, like, if conference is coming up, maybe you have to get more aggressive. But in general, I'd say keep an idea of where they're at on training load-wise to help reduce the effect of fatigue, which we talked about could be a risk factor.
So going back to the second part of my question, I really like that you touched upon that modification of exercise. That's something that I use a lot when I'm dealing with someone who has an injury, trying to see what they can do at practice with their team, because not only is that helping with them still feeling like they're being part of the team, but also with their mental health. A lot of times if you take someone out too prematurely and, you're taking them away from their sport, this is something that you're going to have to be dealing with their injury, and you're going to have to dealing with the repercussions of you're taking away their identity sometimes.
Absolutely. And when we talk about taking people out or like, oh, hey, returning to play, they can still be with the team for certain stuff, right? Like if they're in the weight room, they can do upper body with this injury. Mm-hmm. They can even do single leg stuff on the other leg. You'll still get benefits on the injured leg because there is, cross education. So they can still do stuff with the team. So when we say like taking people out and stuff, we're not talking about full rest because that's just not the reality of athletics, and it's not beneficial to them. Like you said, one, for the mental health aspect and for being an athlete, right? We want these athletes and patients training constantly. We want them to still, exercise can be very beneficial and the strengthening is beneficial. You just have to modify.
I mean, even if you do have to take them out more than you want to, yeah. Having them out doing their rehab during their practice session, and first you're going to get brownie points with coach because they can see it.
Yeah.
It's all about that instant satisfaction, right?
Exactly. And then as far as what you were talking about is like, okay, when do you, pull back, or when do you actually have to take someone out? I think a lot of it's going to depend on the sport, right? Track and field tends to be more conservative. The clinicians / the athletes and the coaches, if something's bothering them, more than likely they're going to allow you that time to rest, which is good. It is beneficial. And then there's times they have to be aggressive as well. But it's not like team sports where you only get so many games, right? Like in track, when you look at the scope of the season, the biggest meet is the conference meet. All the other meets before that are tune-ups for that meet. So if they have to miss like meet number 2 or meet number 5 of the season, it's really not a big deal. And like, hey, we rather have this person at conference where we're actually going to score points. For team sports, obviously it gets a little different because each game matters, and each game, a win can be, can determine the season, a win or a loss. So I think you have to gauge on what the athlete's feeling, how functional they are. Do they have a lot of pain when they're running? Do they have a lot of pain when they're doing their sport, like kicking or, jumping? How does their gait look? Are they limping? Are they struggling to keep up with the output that they're normally used to? How much are they going to be able to contribute to the team? Can they go a few minutes into the game and then have the rest off. I think that you have to kind of judge on your philosophy and your sport.
So, as we like to do here on AT Corner, I love my action items. Randy, can you wrap this up with what can we do to change our practice today?
Yeah, absolutely. I would say the biggest thing, think eccentrically. The hamstrings work in an eccentric fashion. When you rehab, when you're trying to prevent injury, think about it from an eccentric contraction standpoint and focus your exercises on that. And then I would also say, think about the core musculature because, like I said, these muscles connect to the pelvis. The core controls the pelvis. So if the core is not functioning correctly and the punch bowl's swooshing around all over the place, spilling, that's going to put a lot of load on the hamstring. So I would say those should be those two things to focus on.
So if you want to get to reading like Randy, he actually used 26 citations for this one episode, and we'll go ahead and put those on our website, which is going to be in the show notes or description below. And then it will be under citations and resources.
Yeah, and remember, this is our interpretation of the research. So we would love to hear what you do with your hamstring strain injuries or what you've seen work or what you've read and had your different interpretation. And where can they do that at?
That's where you can join our Facebook group and comment on our episode threads and network with other listeners of the show. So you can head over to facebook.com/group/ATcornerpodcast. There's only one membership question to get in. It is, where did you hear about our podcast? And then you'll automatically be approved, and then you can jump right into the conversation.
Perfect. I think I heard of the podcast from you, babe.
Really? I heard about it from you. So let's talk about our next episode as we wrap this up. It will be concussion. Actually, all of next week is going to be concussion. We have an awesome physician coming on that we're super excited about. And we accidentally recorded those this week. So they're already done, and we already know that those are they're great.
And there's a lot of gems in that talk.
There are. And then if you guys are new, we do every other episode with stories and education. So this one was an education episode. So next week's going to be stories. So some upcoming stories are going to be like getting injured on the job, working with pregnant athletes, and then hydration and cryotherapy stories. If you want to submit your own story, you can. We'd love to use it in the show. You can email us at atcornerds@gmail.com. Very nerdy.
That's what we do on this show.
That's exactly what we do. Okay, Randy, you want to wrap it up?
Thank you for helping us showcase athletic training behind the tape. Bye.